Hi guys, what was the last part that you all heard? Because I was just keep on talking and I didn't notice that the connection had gone. There's some problem with Zoom. That's the thing, we missed the connection, I guess. Can some of you tell me what was the last part?
The kid becomes socially withdrawn, like that, about the sim, like
Ah,
about
okay.
things.
Right. Um, Yeah, so the main thing was like the kid is being socially withdrawn. So that means like we do say like, okay, children can't understand and even all sort of things, they are not in age to understand. So they just skip all sort of things. They don't feel such things, Kenika, but it's totally wrong. We can never say that they feel it. They definitely can feel it. The only difference in between a child and the adult is like they have the cognitive. Even Piaget talked about in the cognitive developmental stages, like they are not little adults according to the Piaget says like children are not little adults, like they are not the little formation of the adult, but still the children can feel it. They learn things through through the cognitivism. I mean they learn from the environment to think, reasoning, problem solving, decision making, all sort of things they learn from the environment, and also they can understand. But the thing is, the difference is adult can express those things, but children find difficult to express that because like adult can think logically and think critically, and also they reasoning inductively and deductively. But the children are not that much of a standardized, come to that stand to think something logically, to think something critically, but they think they have some problems of thinking critically and logical thinking, but they are thinking. So they are reasoning out, but still they haven't been mature to reasoning out deductively and inductively. Right? So that is the thing. ඒ නිසා තමයි like they don't know like how to find out, how to find the solution for that, but they have the problem. They are still struggling to find the solutions. So they can understand there is a problem. They have to struggle to find the decision for that. So those are the things are there, so they can understand very well. Even at this the example, the case study which I may shared with you all was the same, but parents didn't realize it. This is because of the grandmother's reason is the death is the reason for this skin. They just say she might be missing it because she used to do the homework and spend the daytime with her. Now she's had to um, spend the time with nanny and she had to be at home now alone, kind of that. So because of this schedule it's been happened, yes, that is the schedule, but the thing is like that the girl was really missing the grandmother, and like she has got some thoughts also in the separation anxiety they are having with some thoughts like I'll be no one is there for me, I'm not loved වගේ කියන negative thoughts තියෙනවා ඒගොල්ලන්ට. So now others can't understand me වගේ කියන එක. So මට මතකයි she used to say like mm, I am understood only by my grandmother. I am comfortable with her, so I can't be comfortable with anyone else කියලා. And the other problem was like we realize it like she is not very close to parents. So the that is some kind of a some error that we are doing for children as a parent and the children relationship එකේදී um, actually like the we have to make the child to be independent. I would say independent කියන තැනදී මේ තමුන්ගේ ඇඳුම ඇඳ ගන්න එහෙම විතරක්ම නෙමෙයි, emotionally independent උත් කරන්න ඕනේ. Because when we are doing the child emotional independence, like not to give some kind of a too much attachment to somebody or some figure. මොකද ඒ වගේ too much attachment එකක් ගියාම obviously for the grandparents කියන එකේදී they are old. So They're all in his 60s, 70s, kind of that, and no one live eternal. I mean, no one live forever. But when it compares with parents and grandparents, parents have more possibility to live longer life than the parents according to their age level. So we have to think about that also. මම මෙතන කියන්න ඔයගලන්ට මේ grandparents ලට ආච්චිලසීලාට ළමන් ලං කරන්න එපා කියන එක නෙමෙයි, but there have to be a limit. දැන් හැම වෙලේම ළමයින්ගේ වැඩ especially like ගොඩක් වෙලාට බෙහෙත් ගේන්න යන්න, medicine ගේන්න. වගේම ළමයින්ව බලා ගන්න. ඒ හැමදේමද ගොඩක් වෙලාට ඉතින් ඔය රස්සාව කරන අම්මලා එහෙම ටිකක් ඉතින් මහන්සි අමාරුයි. ඒ නිසා ඉතින් හැමෝදේම grandparents ලට කරන්න බාර දීලා රැට ගෙදර ගේන පැය දෙක තුනට විතරක් රැට කන්නේත් එහෙම. පැය දෙක තුන විතරක් ගෙදර ගේනවා. So එහෙම කරන්න එපා කියන තැන තමයි I am telling you all, because like as a parent we have to spend the time with our children. You can earn money in the later life. I mean, at least the first 6 years, just spend the time with your children. I mean, do all sort of things. Take to the doctor, giving medicine, cleaning them, changing clothes. So do all sort of things, and don't let anyone else. Try not to let others to handle all sort of things, because those are the personal factors of the child. Child would learn lots of things by doing that. So child definitely those are the child's basic needs ne, security, food and other needs or supply වෙන කෙනත් එක්ක තමයි attachment එක හදෙන්නේ. ඒත් අපිට වෙන්නේ හැමදාම parents ලට කිසිම advice එකක් දෙන්න ළමයිත් එක්ක discuss කරන්න වෙන්නේ, because they don't have attachment with the parents. They are having outside the family. Of course the grandparents also outside the family. Family එකේ ඉන්නේ parents ලා ළමයිනේ විතරයිනේ. So then other all the other figures are outside the family members. එතකොට ළමයා එතෙන්ට යනවට වඩා අර ඇතුලේ කාට හරි බොන්ඩ් ඉන්න අයත් එක්ක බොන්ඩ් එක හදාගන්න එක තමයි healthy. So there is no other way to, I mean, no other people to gain that place where the parents should need to have it. So as a parents, that also what we have to think about it, like giving a quality time to our kids, at least like the first 6 years of them, because that is the important foundation of your personality. Because like they are building up the personality, starting the personality, start to collect the traits in this from birth to 6 years. ඔය කාලේ තමයි ඒගොල්ලන්ගේ උපරිම කාලේ වෙන්නේ. Even the Freud talk about oral stage, anal stage, phallic stage එකේදී, because those are the very important factors where they learn the trust, how to trust, and where they build up the satisfaction about themselves and building up the like I am love කියන එක, I am treated, I am loved and I am treated well, I am cared well ඔය කියන ඒ thoughts හදාගන්නේ. So even නැති වුණාම Freud talk about like the people, kids are getting dissatisfaction and then frustrated. It's being frustration feeling, it's being fixed in their life. So many problems happens because like parents can do lots of things rather than the other caregiver figures. So ඒවත් එක්ක තමයි දැන් ගොඩක් වෙලාට, so I just talk something extra thing also related to the separation anxiety. So even with the death of the person, also the separation anxiety could be happen. With the place, changes of place, also separation anxiety could be happen. And also the withdrawn, when the child is withdrawn with somebody like parents, as I mentioned earlier also, if anyone goes overseas for a longer time period, so then they might get these separation anxiety features. So the main thing is the external factor where we can understand is other factors, education, decreasing the educational performance, social withdrawal, and being inactive, where the child used to be, because before this happens, child used to be very active, but now it's not like that. child is not very very active, and a child is really lethargic and being just isolated. He always thinking and being in another world, but find difficult to express also. When we ask also, he is saying, no, I'm okay. That's just a common thing where the children used to say, නෑ මුකුත් නෑ, නෑ මම මුකුත් හිතන්නේ නෑ, ඔහොමනේ කියන්නේ. ඕන එකක් ඇහුවත් එහෙම තමයි කියන්නේ. And the other one is like, if it is separated from a place or something, they might getting sleep problems. බාගෙට නැගිටිනවා, නිින්දෙන් නැගිටිනවා, and bedwets during the night time. kind පොඩි ළමයි නෙමෙයි, අවුරුදු 4 5 ළමයි එහෙම සමහරලාට grade 1 2 බබාලා එහෙම continuously it happens, not every day. එතකොට එහෙම වුණාම like as a parent, දැන් ගොඩක් වෙලාට කරන දෙයක් තමයි අපි විහිළු කරනවා. We just kidding the child. And I mean tell jokes and all. අයියෝ මේ මොකද මේ pampers එකක් අඳන්න ඕනේ එහෙම කියලා. Please don't do that. මොකද bed wet කියන එක suddenly එනවා නේද? bed wetting කියන එක it's been stopped by 3 4 5 වගේ විදිහට පොඩ පොඩ අඩු වෙනවානේ. ඒ අඩු වෙලා ඉඳලා එක පාරට මේක ආයේ කොහෙන්වත් ඇවිල්ලා වැඩි වෙලා හැමදාම වගේ වෙනවා නම්, දවසක් දෙකක් වෙනවා නම්, you have to be very careful why this happen. මොකද්ද මේ ළමයට වෙලා තියෙන්නේ? ඒතර මොකක්ම හරි දෙයක් වෙලා තියෙනවා. There is some stressful thing. So as a mother, you have a very good responsibility asking the child. ළමයාව observe කරන්න එතකොට. ළමයාට විහිළු කරන එක නෙමෙයි. Please don't do that. So ළමයාගේ observe කරන්න. Definitely play area එක play කරන වෙලාවට observe the child. How the child being other children. ළමයි එක කොහොමද ඉන්නේ? යාගේ යාළුවොත් එක කොහොමද ඉන්නේ? වෙනදට වගේ actively play කරනවාද? So නැත්තම් you have to, I mean, concern about that. ඇයි මේ සෙල්ලම් කරන්නේ නැත්තේ? අනිත් එක කන එක. කන්නේ කොහොමද? වෙනදා වගේ කනවද? ආස කරන කෑම ටිකක් හදලා දෙන්න යා කනවද කියලා බලන්න. Because usually දැන් හැමදාම කොළ මැල්ලුම් ඔහොම දුන්නාම එහෙම තින් කන්නත් ආස නැති නිසා you can observe it, but just make something. Sausages or fried rice. හරි ඒත් හරි ආසාවෙන් කන්නේ නැද්ද? So then also like it is also alarming for you, okay, the child is under stress. Stress වුණාම තමයි bed wetting වෙන්නේ පොඩි අයගේ. එතකොට you can understand it, okay, the child is being stressed. And also observe the mood. කතා කරද්දි නෙමෙයි, තනියම ඉද්දියාගේ mood එක කොහොමද? sad blank mood එකක්ද? Usually අර තිබුණු ලස්සන මූණ නෙමෙයිද, happy මූණක් නෙමෙයිද තියෙන්නේ. So most of the time separation anxiety children who suffered with this, they are being very blank and very sad. Sad blank, har long face එකක් තමයි තියෙන. තරහ ගියේ නෙමෙයි, අර දුක හිතිච්ච හරිම long face එකක් තියෙනවා. And also on the other parties, you can understand the child, you can read the children is drawing. Chitra, drawing tamai other thing, other basic media of understanding or reading the children. Just give them to draw. ඒක තමයි කියන්නේ පොඩි ළමයින්ට ඇත්තටම drawing කියන විෂය මේ ළමයිගෙන් ගන්න එපා කියන එක. මොකද ගොඩක් වෙලාට in the primary schools like this drawing කියන එක වෙන්නේ නැහැ දැන්. It's being stopped by grade 1 or nursery. ඉතින් එහාට drawing art කියන එකක් නැහැ. We are not giving much priority for that.
Excuse me, ma'am.
Yes.
Some adults also do bedwet, ne?
Sorry.
I know one girl, right? She's in
Huh?
her teens. She do bedwet during night time. Will there be any particular reason for that?
She's 13.
No, she's 18.
18.
It's a big issue. No, even after marriage also that we can decide, right?
So is it been continuing from the smaller days or suddenly started?
From the small, no, not continuously. She do bedwet in grade 5 about 5. Yeah, she stopped, and suddenly she started when she came to teens. Mm, that's the problem. No, about 13 or 14, she started again the bedwetting.
So
Yeah,
continuously it happens.
yeah, yeah, continuously it happens. Mm,
Every day, the like once in a while there.
not once in a while, but like after 2 to 3 days, like once in 2 days or 3 days, like that.
Uh-huh.
Uh,
So does she follow any precautions? I mean, using some sanitaries or using මොනහරි ඇඳට දානවද මොකක්ද එහෙම
uh,
you don't know that.
no, like that she don't do, and she's not staying in family houses and all.
Sorry, it's not clear for me.
In other family members' houses, she don't use this stay. Yeah, because she knows, right, that she's doing bed Kela. So she don't stay in other houses, uh, like that, in family functions and all. She used to go to her home even it's night. Like that is a big
Mhm.
shame for her.
Yeah, I feel she needs to go for a doctor and meet.
Mm. I think
I mean,
yeah,
I
she
can't exactly tell what the reason is because, like, I haven't talked to the person. So
yeah,
there could be so many reasons. I mean, so it could be biological reason also in his urinating system or something. It also could be,
yeah,
right?
she has consulted a doctor also, but he has said that no, there are some psychological problems only. There is no issues in her body or like those things.
So then yes, then definitely a
Yeah,
psychological problem. එතකොට why she's not, I mean, ගිහිල්ලා නැද්ද? Didn't she?
no, they didn't. They feel like shame or something.
That's the thing. I think now
Yeah,
18 කියලා කියන්නේ like she's
yeah,
in there අර මොකද්ද gate එක ළඟ වගේ ඉන්නේ like I mean after 8 19 kind of
yeah,
that personality also being fixed kind of that.
of course,
So
yeah.
I would say as soon as possible just go for a doctor. And it's not a big issue. I mean, once you
Mm.
go for
But
a,
she's
maybe it's a
so
psychological
stressed.
problem. She might be having some thoughts and being stressed out for something.
Yeah.
මොකක් හරි දෙයකට එයා ස්ට්‍රෙස් අවුට් වෙලා තමයි ඉන්නේ.
Mm.
Something මොකක් හරි we can never say without talking to the person. I can't say what the reason is kind of, but
Mm.
like there are treatments for that. ඉතින් ඕකට
Mm.
බෙහෙත් බොන්නත් අවශ්‍ය වෙන එකක් නැති වෙයි. Just to relax
Mm.
එකට මොන හරි බෙහෙත් දුන්නොත් ඇරෙන්න.
She's a very talented girl, and she's doing the bio, and so
Mm.
talented, coming first in the class like those. But she's so stressed because of this, and can't tell to
Yeah,
anybody
obviously getting
like
stressed
this.
ne.
Yeah.
Because like Ita now you said she's a very studious girl. If she
Yeah,
go for a campus or something, how is she going to manage it?
of course.
Aren't they?
And
So definitely yes. She
yeah,
can't have the continue the very free life with this problem. So
of course.
definitely she has to go for a psychiatric.
Yeah, they are her siblings and all getting fun of it. Her,
Of
um,
course.
so
Of
she
course,
gets
yes.
so angry, and she's short tempered. It's a very big
So
problem.
obviously being short tempered.
Yeah,
Short tempered නෙමෙයි ඔය ළමයා depression වේ ඔය විදිහට ගියොත්. She will ended up like depression, may depressive person.
yeah.
Because
After this
what it's a
problem, she don't move with others normally.
yeah.
She's being, yeah, alone and all. We can't see
So
her like
normally
that.
it happen. No one can't do anything for that
Yeah,
because psychology problem එකකට වෙන කිසිම කෙනෙකුට කරන්න බෑනේ. So
yeah,
only the person who treat for the psychological problem is psychiatric and a clinical psychologist. That's it.
yeah.
No one can do. I mean, like even if we just advise kara kela, like we
Mm.
can't do anything. We can't cure the person. මනසිය ඔහේ අහගෙන ඉන්නේ ඉතින් කියන හින්දා. ඒ මොන හරි කිව්ව එයාට දැනෙන දේ ආය නැවත කිව්වම වඩු වීසේ පණ්ඩිතයි කියලානේ කියන්නේ. We do say you are being
Yeah.
panditya here and do like this එහෙම කියලා. But the person find difficult to do. ඒකයි තියෙන. She has some thoughts kind of that. ඉතින් we have to change all sort of things and මොකක් හරි stress situation එක අයින් කරලා we have to relax the person. ඉතින් ඕවා කරන්න ඉතින් ඔය psychiatric කෙනෙක් හරි very first she has to go for a psychiatric. There are female psychiatric, lots of
Yeah.
psychiatric are there.
Her father also not at home. He comes about once in a month, like that only. And he even he comes home. He used to fight with her mother. So fight with her mother means so some issues about children's or something. He's they are not being as happy at their home, always
Could be.
fighting. Yeah,
Yeah,
the
there
siblings
could
and
be any
all.
reason.
Yeah.
So mainly there, I mean, we don't know what is the exact reason. Definitely there is some antecedent and a thought and the reason incident was there. So she has to talk about those things. So as a like if you know all sort of this, just tell them. It will be worst.
Yeah, of
ඒකයි
course.
වෙන්නේ. ළමයා
They can't
තවත්
decide about the marriage life and all, right? That was a problem.
මෙහෙමනේ
No.
දරුවෝ මැරේජ් එකට යන්න කලිනුත් හෙල්දි ලයිෆ් එකක් ගෙනියන්න බෑ.
Yeah, no.
නේද?
Their
We
parents
have
are
to
telling
be a
that.
healthy person නේ.
Yeah.
Even before go for a marriage. So marriage එකක් විතරක් නෙවෙයි,
No,
not only a marriage, like just to live with other people,
of
just
course,
to
no.
live alone.
Their
තනියම
parents are
ජීවත් වෙන්න. And
the
it is otherwise it's annoying නේ.
yeah. Their
Yeah, I
parents are
think
telling that see, will you very big issue is there with you, so we can't decide
try to
about your
acknowledge
marriage.
the
Like
parents,
that,
I think, like
they are making she more stress. We can't decide how can you marry like that.
අයියෝ.
Yeah, no, we also
Yeah.
can't tell anything to them, right? At the
Is
parents.
that so?
Yeah.
But try it. ඔයගොල්ලන්ගේ parents ලට හරි කියලා පොඩ්ඩක් කියන්න බලන්න.
They don't consider about that. They don't want to see a psychiatrist or like that. They don't take it a big issue, and that's the problem.
That is the thing. And you all, I hope you all can understand this.
Yeah.
Still like in Sri Lankan situation, like it is not, we can't blame for the people also. That I really like when they're having also them having podi podi masa haya hatte diploma courses වගේ තියෙනවා නම් I really like because at least not to the ඔයගලන්ට මේ level එකේදී ඇත්තටම මේක කරා කියලා ඔයගලන්ට professional මුකුත් කරන්න බෑ. You all can't do that, but you can understand the life. So I mean you can understand lot of things in the life. දැන් ඔය වගේ issue එකකදී දැන් I hope like you would be different කියලා. If you find someone known person with such things, I hope now ඔගොල්ලෝ ඒ වගේම හිතයි කියලා නම් මං හිතන්නේ නැහැ. I'm expecting you all to be different, please. Because like ආයෙම හිතපු තැනටම හිතලා නම් මේක කරලා වැඩකුත් නැහැනේ. I mean, it's just a waste of time of mine also. I'm just talking and just wasting my energy. I hope you all can understand it. At least like this thing, we can't do anything just to keep the person at home and just giving advices, just giving all the මොනවාද summons කියන එක නිකන් දේශනා දීලා වගේ බණ කියලා මේ මනුස්සයට වැඩක් නැහැ. So at least to take the necessary precautions, that is the most important thing. අද ගොඩක් වෙලාවට මිනිස්සුන්ගේ කරන්න නැති දෙයක් නේ. අසනීප වුණාම කරන්න ඕන දේ කරන්නේ නැහැ. We don't take necessary precautions. We just hide and just wait. ඒක නෙමෙයිනේ කරන්න ඕන. I mean, if you take the necessary action steps on that, you would be fine, definitely. අර ඒක එච්චරටම යන්න ඉතින් අදටත් ඒක තියෙනවා. I think it's very pathetic situation. So the people who struggling is really, I feel really sorry. So can't help, yes.
Excuse me,
Okay.
miss.
Yes.
Miss, this for if this bedwetting thing, is there any therapies we could do for them? Like, is there any treatments psychologically we
Therapy
could
in a
do for
sense,
them?
most of the times we do the CBT and the relaxations.
Okay, is like for any age, like if it is for an 8-year-old kid also, is it the same? Like we can do CBT for them
Yeah,
also?
8 year උනත් thoughts තියෙනවානේ. We had so I mean whatever the thing is, දැන් අපි පොඩි ළමයෙක් එහෙම ආවහම we don't say for that child we are going to do CBT එහෙම කියලා කියන්නේ නැහැ. But we do like talk about the thoughts ඔයාට මොනවාද හිතෙන්නේ, what do you feel, what do you think එහෙම කියලා. So we talk about that එයත් එක්ක. So however that CBT being applied.
Can it be cured, ma'am? Oh,
Bedwetting the
yeah.
yeah, we can. It's not a big thing. It can, because the reason is like person is stressed out for something. Person having some kind of a fear and being stressed out. ඕක නැති කරාම it's being like, and the other thing is we do giving the relaxation techniques for the person. Relaxation activities before sleeping and before go to the bed, and while sleeping, yeah, sometimes we do ask them to put on the music and sleep. ඒක කරන්න කියනවා. And also like we are දැන් යාගේ දැන් තියෙනවානේ time එකක්, time some they do have an exact time duration. පාන්දර 3ට 4ට ඔහොම තමයි bed wetting වෙන්නේ. So then one thing we do say is put an alarm and you go to the washroom and come කියන එක. So then it doesn't happen. මේකත් එක්ක කාලයක් ඉක්ුණාම so then it's done, and make sure to go to the bathroom before go fall asleep, and then keep an alarm and then go to the washroom, and then you want කියන එක. So then like the even like we very initial stage we do like that. So even though once you put the alarm and you go to the washroom by consciously yourself, Punat, you are being very satisfied about yourself. Ah, okay, today my bed is clean, I didn't do anything here. So the next morning you are being really happy and your day is very productive. නැත්තම් අද day එක productive නැහැ. Because like I don't like to happen this and I'm worrying also. එතකොට දැන් a day productive day also very important. So then with the productive day you are going for the bed next day.
Yeah.
So this day you are going to the bed with a very productive day. You have a very, very good pleasant day. So you're having that thought. So you're having that determination. Ah, okay, so today I try. කියන එක. So like with the ඔක්කොම thoughts එක තමයි we do that. Because they
Excuse
are
me, miss.
getting, yes.
In this, there's one of my known person. Like she's a small girl.
Hmm.
I know her through a hostel. So she's around 10 to 11. She was
Hmm.
in Oman before, and she had some trauma, like her father got accident and something like that, and she was sent back to Sri Lanka. And in that, from then onwards, like she used to do bedwetting. So like
Hmm.
for this, maybe she's missing her mom because her mom is in Oman and she is in Sri Lanka. So and she's very small, right? After that only she has started this thing. So in hostel they used to punish her and stuff. So for this
අයියෝ.
situation, will it be okay if she is sent back to her mom because maybe she's missing her mom and that's why she's doing this. If she is
Ah,
going back to her mom, will this become okay?
sometimes it could be, but like I would say it's better to go for a doctor and find some relaxation things, because you mentioned that when she was in hostel that she was punished, and obviously
Yeah.
her friends knowing that bullying, so she must be definitely having some negative thoughts towards herself and others.
He is like or like she don't have like usually 10 years kids they're so active, right? This girl is like she goes sit in a corner, she don't talk to
Ah,
anyone, she don't even
okay.
know to talk properly, like she was in Oman and she knows to talk only Arabic, so little only she speak Tamil also. So like it's a
Mm-hmm.
very hard situation for her, she's suffering a lot. And she gone to doctor and in there they are giving some tablets. she's using some
Mhm.
tablets. But even
Mhm.
after using that, she has this bedwetting thing. But then it doesn't stop.
Doctor,
Like
who is the
we,
doctor? Just a physician, then other psychiatric. The
it's just a physician, not a psychiatrist.
Aniti
She didn't.
physician, no way, because
Yeah,
physicians are specialized for biological things.
yeah, I think so. She has like some mental problem because like she's not like an ordinary kid. She don't talk. She
So,
don't.
bedwetting when most of the time psychological, unless she has urinate problem. If
Yeah,
she
and like
has
in
some
hospital also
urinate
she's
problems
suffering a
and
lot.
so when the bedwetting happens as a parent and adult, very first thing is just notice it how often that she goes to washroom during the daytime. Usually for the children it is like 5 6 times. ඊට වඩා යනවා නම්, so then it is a problematic situation, right? And if even it is the less time, හතරට එකපාරක් දෙපාරක් වගේ යනවා නම්, that also a problem. And how the amount of water that she drink, does she drink enough water? දැන් වතුර බොන්නේ නැතුව වතුර හරිය ගොඩක් දීලා යන්නේ නැත්නම් it's also a problem. වතුර බොන්නෙත් නැත්නම් then you can give some water and see whether it's going to be happen. And then just ask from a child, when she urinates, does it feel, I mean, hot and all? Is it uncomfortable for her? So that is one reason, one biological reason which could happen in the urinary system. එහෙම නැත්නම් like and see the color of it. Usually it's white or light yellow නේ. Then dark yellow, the dark brown, the light brown, red කියන එක බලන්න. And if there's a smelly ගොඩාක් bad smell එකක් තියෙනවා, then you have to go for a urologist and see this
Yeah,
is
like
also having.
it's like very bad after she like wake up. The room will be like the mattress and everything will be like smelling so badly. And for that, the from hostel wardens they used to punish her. They used to hit her. Oh my God, it's really hard to see that.
అయ్యో.
And like when you were saying, I used to remember her only. I was really feeling bad for her.
So still she is in the same hostel.
Yeah, she's in the same hostel because her mom is in abroad and she can't take care and
Is it a
something.
government
Some
school?
No, no, it is like just like for orphans, they have that hostel. Like I was once going to that hostel, like from my family, we used to go and donate. So then I know that people. So she used to say, she used to come to me and talk. So I know her. Like when other students also say, like, yeah, Dati, like the warden used to hit her and
If you
stuff. It's
don't mind,
really
like,
hurting.
may I know what is the play? Where is the place?
It's at Mardana.
What is the place?
Uh, I exactly don't know. It's it's also from a school only. So
Uh-huh.
yeah,
What is the school?
it's an Arabic school.
Uh-huh.
Uh, so they have it for
Only
like
girls are there.
yeah, only girls are there. So they are doing it full of free. They don't charge anything.
Uh-huh.
So food and everything is free for them.
But was that thing hitting and all, it's very inhuman.
Yeah, that warden auntie only like she's a bit rude. I think now she's not there maybe because like most of the kids used to complain and I think she might be left from the hostel. She might be taken off. But other teachers are so sweet. They take care. But always the teachers won't be there, right? This warden, like she's the one who has to wash and stuff. So that time she gets annoyed and she used to hit it.
Mm-hmm. Yeah, the thing is like sending back, yeah, could be one reason, but I don't think like it is a biological reason. It seems like psychological issue. She seems that she had gone through very traumatic incident, and also like she's been separated from her family, and all thing at them psychological issues. I mean,
Yeah.
children or even adults, if we can't find tolerate all sort of things, අපි මේ චුට්ටක් මාස දෙක තුනක් යාළුවා හිටපු එකෙක් දාලා ගියාමත් like we are being like really නේද නැත්තම් and also like කොහේ හරි තැනක job එකක ගිහිල්ලා මේ චූටි comment එකක් ආවමත් we are being having a very long faces and kind of that නේ එතකොට අර වගේ දෙයක් වුණාම ළමයින්ට කොච්චර වෙන්න පුළුවන්ද how it could affect for the children එතකොට definitely there would be psychological issue ඉතින්
If
ඕකට
she don't take treatment now, will this be affecting her future also?
of course yes 1000% yes
Oh my God.
it will affect it definitely it will affect it
I
so
wish
that is the
I will
thing
try
then
to search
if
her again.
you can if y'all can just take her and see how was the clinic
Yeah, miss, I'll try to take her. I'll try
yeah
to
just
contact
take
him.
her
Yeah.
ඇත්තන් දැන් ගොඩක් කලාට පොඩි අයව නම් online counselling යවන්නත් බැහැ just take for a psychiatric and see there are very good psychiatric here in our local Dr. Professor Samanmali is very good
Mhm.
so just take to a lady psychiatric and just talk to her ලංකා hospital එකෙත් තියෙන central එකෙත් තියෙන very good clinical psychologist කෙනෙක් ඉන්නවා Dr. Achini Rupasinghe she is also very good so you can consult one of them and just මෙයා කරලා then you can find out what is the reason කියන එක
Mhm.
නිකම් බෙහෙත් බීලා unless it is a urological problem so no point of drinking medicine නේ
Yeah.
තේරුමක් නැහැ okay right I hope that separation anxiety is clear for you all any questions related to that okay so then we'll move to the next one
Ma'am,
yes
can you recommend any psychiatrist for her bedwetting problem?
mm, in Navaloka, I'm not, you just check with them. Professor Saman Mali. Professor Saman Mali is really a well experienced doctor. She used to work in LRH. And Dr. Sudarshi also very good. She also she also works in LRH and Ragamayati. She also comes to Navaloka. In Central, she is not a psychiatric, she is the clinical psychologist, Dr. Achini Rupasinghe. She is also well-trained clinical psychologist. And she recommended, she has a Dr. Neville Fernando. So he's a doctor, he male කෙනෙක්, but they both are parallelly doing it. බලන්නකෝ ඒ දේ එතන තුන්දෙනාව contact කරගන්න බලලා just try.
Will they do in English or language?
Yeah, they will.
Okay.
Definitely yes. They are all specialized for children.
Okay, ma'am. Thank you.
Yes.
Ma'am, can I take my ADHD son for one of this doctor? To one of this doctor?
Yeah. Another. Yeah, they can. I mean, y'all can if it is ADHD also. They are very good because one of my autism kid who came to some activities for me also. He also referred to there, and the doctor was mingled with him. The parents very good and do all sort of things nicely. Can take.
Miss,
I
you are
prefer.
also in counseling?
And even if
I
y'all
wish
can,
if I can take to a Lady Ridgeway doctor because I want to move on to a Lady Ridgeway with him. First, I'll check
yeah,
in the
just check
private
with.
hospital and then.
Because Dr. Sudarshi and Dr. Samanmali both come from Dr. Sudarshi and Samanmali. If I'm not mistaken, Dr. Sudarshi comes to Ayati in Ragama. So Professor Samanmali is, yeah, I think she is still there in LRH. just check with them. You can just give a call and just check with them, and just give a call to Navaloka. Then Navaloka it not for sure. Just check with Navaloka.
Okay.
There's another doctor, I can't remember her name. Just remind me, like for the next session, I'll tell you. She also very good. She's really good. We specialize with autism, and also I think autism features at the same hyperactivity features. She's really good. She also works in LRH. I can't remember her name. I'll definitely find the name and let you all.
Okay, ma'am. Thank you.
Once I find the name of the doctor, I'll just put into the thread. So then y'all can go ahead. And for especially for the ADHD වගේ නම් මොනාද in Lanka, Dr. Kumaranayaka, I don't know whether you all have overheard. He is very famous and coming to the programs වලටත් එනවා. He also good. Because I like his way of treatments for the especially ADHD kids. He's not practicing now in the government base. He's retired, but still he comes to Win Lanka in Kohuwala. If y'all are close by, like if you have any people, you can recommend him also, because in some doctors, like it depends the thing. Then අපිට උණ හැදිලා ගියාම සමහර දවසෙන් දෙකෙන් හොඳ වෙන්න බෙහෙත් දෙනවනේ. So we like අපි යනවා එතකොට. ඉක්මනට cure වෙනවනේ. So we like it and we prefer that doctor. But that is not very good thing. එතනදි කරන්නේ මොකද්ද? The doctor, we are given high doses. So high doses දුන්නාම, once the high doses are given, our body is getting addicted to that. ඊට පස්සේ පැනඩෝල් එකක්වත් ආන්සර් කරන්නේ නැති වෙනවා. But that Dr. Kumar Naik was not like that. He is giving very light medicines, and he always try not to medicine will in control when and his techniques also good. If you all can, you all can take, if anyone, you can research.
Okay, ma'am.
Okay, so then we'll move to OCD. No, I don't do counseling now. So I don't practice it with my busy schedules and all. I just stopped for a while. So nowadays I'm not doing the counseling practices or psychotherapies. I'm just doing few training for special needs, kind of that. Mainly I work with lecturing and my research thing, so I don't do. Okay. The next one is OCD, obsessive compulsive disorder. So OCD කිව්වහම like අහලත් ඇතිනේ, it's very common. ටිකක් හරි common එකක්. Then what do you all know about OCD? OCD අහලා තියෙනවද? Have you all ever heard OCD?
Yeah, it's easy that that person is not satisfied with doing one work at a time. Like they go do the same thing again and again. Example, like if they wants to if they wash a cloth, they'll be again going and washing it because they'll be not satisfied like it is clean or something.
Yeah, okay. Yes. Anything else? Anyone? Yes, do you all know anything about OCD?
Mainly they are obsessed with having clean things, having everything in an orderly manner. They are obsessed with certain things.
Okay. Yes. OCD, yes?
No, it's a chronic and a long-lasting disorder.
Sorry?
it's a long-lasting disorder, right?
Ah,
And it has uncontrollable, reoccurring thoughts and
okay.
behaviors like that. Uh,
Okay.
but yeah, that's it.
Yeah. So I'll just start with long lasting කියන තැනින්. Yes, it's long lasting tama. So how it been said, I mean, how it, what it may be to be long lasted like that. Because we don't, at very initial stages, we don't pay much attention on that. අපි ඒකට එච්චර consider කරන්නේ it is a big thing කියන එක. The thing is, දැන් OCD කිව්ව ගමන්ම අපේ ඔළුවට එන්නේ cleaning. We just take that cleaning and washing. And OCD come washing hands එහෙම කියලා කියනවා. So it is not only OCD, it is just a one part of it. OCD in a sense, we are having the repetitive behaviors or repetitive thoughts. That is the OCD. OCD people, they have thoughts and behaviors. Obsessive means behaviors, and the compulsives are the thoughts. So they are having behaviors and the thoughts, repetitive behaviors and repetitive thoughts. So behavior එකත් මොනහරි කරන එක ආය repeat වෙවි කරනවා. So mainly the very first they gain the thoughts. ඉස්සෙල්ලාම thought එකක් තමයි ඇති වෙන්නේ. Any thought. මොකක් හරි thought එකක්. Now for say an example, everything has to be neat. Right? ඔහොම thought එකක් එනවා. අපි කරන වැඩේ හරියට කරන්න ඕනේ. Whatever things we do, it has to be done in a correct manner. ඔයාත් උගන්වනවානේ, even at the parents do say, teachers do say, okay, whatever the you think, whatever things you do, you have to do it in a correct order. හරියට කරන්න ඕනේ ඒවා. So it has to be in order. It has to be done accurately. Like that we do say. So then child gets that yes, I have to do it in accurately. I have to work in, I want to complete it in order on perfect way. Right? So then they are having the thought, making up a thought, I have to be a perfect person. Or that I want to be a perfect person. කියලා හිතනවා. So perfect වෙන්න නම්, how to be a perfect? I mean, how do we say it is a perfect කියලා කොහොමද කියන්නේ? Perfect means there won't be any errors. There won't be any weak points. කිසිම weak point එකක්, error එකක් තියෙන්න බැහැ. It has to be in a very orderly, and then there can't be any errors. So very clean and clear වෙන්න ඕනේ. Right? Clean and clear කියලා කියන්නේ whatever the scenario or the scene also has to be very clean. Clean කියලා මම මෙතන කියන්නේ පිරිසිදු කියන එකම නෙමෙයි. It has to be in order. So that is called perfect. So then that thought works out within them, and then whatever the things they do, they try to do it in a perfect way. එතකොට සමහරලාට දැන් මේ රාකයකට පිගන් නැම්මුවා කියලා හිතන්නකෝ. So then they, even like when they are keeping the mugs on the rack, ඔක්කොම එක විදිහට තියෙනවා. Handles ටික එක පැත්තකට. All the mugs, the handles are in right side or left side. එකක් හරි චුට්ටක් ඇදේ වුණොත් එම ආය අරගෙන ආය තියෙනවා. That is how they do. So everything has to be perfect. ඊට පස්සේ හොඳට බලන එක ගානට තියනවාද කියලා. And some, when they are coming with very, මුලදී පටන් ගන්න එහෙම, they are just starting that. So it is not an abnormal thing, even that when do we notice something and we do appreciate the person. අනේ හරි පිළිවෙලයිනේ ඔයා එහෙම කියලා අපි කියනවානේ. You are very accurate and very nicely doing all sort of things. How really good you are. How she is කියලා අපි ඉතින් කියනවා. So then the person is I'm motivated and yeah. So then when I do the things perfectly, I'm being appreciated also. ඊළඟ දවසේ තව ටිකක් හොඳට කරනවා. එතකොට දැන් අපි කප් එකක් අපි දාන්නකෝ we are putting it into a 75 percentage මේ මොනවද degrees වල angle එකට කියලා. ඉතින් ඊටු ඔක්කොම ටික 75 degrees angle එකට තමයි තියන්න හදන්නේ. And some I met one of the person in the clinic settings මේ කප් එක කියද්දි මට මතක් වුණා. So in මේ මොනවද man kenekaya. So in the kitchen, he wants every cups to be in the same side, and then like he used to he came with a wife, and then wives used to say අපේ මහත්තයා මේ රූලක් හරි මොකක් හරි තියලා බලනවා හැන්ඩල් ටික ඔක්කොම කෙලින් තියනවාද කියලා. So it is something like really abnormal, like person used to think like they check the things where they are in order එහෙම තියලා ඇදේනම් then he is called a husband, my wife, and then sometimes he used to rearrange them. ආයස් කරපු ආයස් කරනවා අරගෙන. So it's time consuming, like who can handle all sort of things. ආයස් කරන වෙන වැඩක් කරන්න වෙලා නැහැනේ. So that is one thing. So then cleaning මනේ මෙතන තියෙන්නේ. අර තියෙන පිළිවෙල perfect එක. And these people, like wherever they arrange something, they has to be in order. ඒගොල්ලන්ට පොතක් මේසේ if there are pile of books, that has to be exactly a pile. පොත් එහාට මෙහාට වෙලා චුට්ටක්වත් ඇද වෙලා නූලක්වත් ඇද වෙන්න බෑ, දශමයක්වත් ඇද වෙන්න බෑ. It has to be in order. හරියට ගාන්ට පොත් ටික අස් කරලා ලස්සනට අර මොකද්ද වගේ තියෙනවා. Then like again when they හිතන්නේ දැන් පාඩම් කරන කෙනෙක් කියලා. ඕක කරන්නත් විනාඩි 5ක් 10ක් යනවානේ. And also they are redoing it. කොච්චර කරත් they are not satisfied about that. So they think like there would be something. Not sure about it. Having a reassurance also. Problem with that whether I have done it correctly. කියන එක. ආය කරලා බලනවා. And even like this man same කෙනාම තමයි රූල තියලා කෙලින්ද අර පොට් එක කෙලින්ද කියලා තියලත් බලනවා කියලා. So that is a severe case එකක්. So රූල තියලා මයින තරමටම ඇවිල්ලා. But it was not started from the beginning. That was added. All sort of things were added in the later life with the time. So that was, and remember books and the clothes. Closet එකට දාන clothes උත් එහෙමයි. And who can do those things කියලා හිතන්න. රෙදි ටික පිළිවෙලකට ඔච්චර දාන්න තියලා රූලක් මැනලා තියන තරම්. So that person, after doing that only he can satisfy himself. Otherwise he can't satisfy himself. The other thing is then මේගොල්ලන්ට තියෙන අනිත් ප්‍රශ්නේ තමයි අනිත් කෙනා කරා okay fine. අපිට සමහරලාට අපි කියන දෙයක් තමයි එයාට මමස් කරලා හරියන්නේ නැහැ. If I even though if I arrange the table, once he came home he again rearrange it. So no point of arranging. So sometimes other people they just quit it. කරන්න නැතුව ඉන්නවා. එහෙමත් ඉඳලා සමහර තැන් තියෙනවා එහෙම අතාරින්නත් බෑනේ. දැන් කරාමත් like he used to come and again redo all sort of things, and he gets angry when the things are not happen, and he thinks like others are ignoring him කියලා. Him or her. So every day I do these things in accordingly, and I'm telling you also it has to be done like this, and you are not doing it. You are not concerning my word. ඒකට දැන් family එක relationship එක නම් ඕවා තමයි ප්‍රශ්න ඇති වෙන්නේ. relationship එක නම් සමහර වෙලාවට like ඉතල දුරනේ ඉන්න ගෙවල් දෙකනේ. ඉතින් ඕක හිතෙන්නේ මේ මනුස්සර පිස්සු කියලා ඉන්න. හැබැයි ඒක කොච්චර අමාරුද කියලා දැනගන්නේ when you happen to live with that man. So the other problem is they can't just ignore it and go. කොච්චර ආදරේ වුණත් කොච්චර කොහොම වුණත් they can't just ignore it and go. ආයෙම හිත කියනවා නිකන් තට්ටු කරනවා වගේ නෑ ඔක හරි නෑ ඔක හරි නෑ. It's not in the correct way. You go and do it. You go and do it. Go and do it. කියනවා. So when we talk about the OCD people, so in my clinical එකේදී නම් I used to work out lot of OCD. මගේ ගොඩක්ම කරපු වැඩිපුරම තියෙන්නේ OCD cases. There are lots of cases in different thing, and I'm really interested in doing OCD also. So but OCD people are very interesting. අනිම ඉතින් අර එක එක්කෙනාට එක එක ඒවානේ තියෙන්නේ. එකම දේත් නෙමෙයි. දැන් depression ගත්තාම depression ආට තියෙන්නේ එකම ටික. like they're having negative thoughts, kind of that. But OCD is very different to different. එක්කෙනෙක් පොට් එකක් ගැන ප්‍රශ්නයක් තියෙන තව කෙනෙකුට තව මොන හරි ප්‍රශ්නයක්. So it's very interesting. So the problem was like, and when we are explaining like what I mean, how it disturbs from you, like they used to write and they used to say, ලංකේනා නිකන් අර කවුරු හරි එලා පිටට තට්ටු කර කර එන කියනවා වගේ තමයි මට දැනෙන්නේ නෑ. යන්න ගිහින් කරන්නකො. Go and do that. Go and do that. Go and again do that. It's not a way. It's not a correct way. Because who is annoying is my own mind. Mind is annoying for me. That's what. Otherwise, no one is coming and annoying me. Only my thoughts. My thoughts is being circulated and say no. It is not in order. It is not in order. It is not. It's not done in a perfect way. It's not my viewpoint. So then they can't control. So then they are going to redo it and all. අනිත් පැත්තට ප්‍රශ්නයක් because like I waste my time and I did all sort of things, and again this man is, or this woman is screaming and again redoing it. So no point of කියන එක. And the other one is සමහර වෙලාවට like they are having checking problems. Repetitive එකක් check කරන එකක් තියෙනවා. Especially doors and all. සමහර අයට තියෙන ප්‍රශ්නයක් තමයි මේකත් ටිකක් common එකක්. Like even though they checked once before හිතානකො හරි යන්න කියලා, they're checking it. Lock කරලාද කියලා ඔක්කොම ටික බලනවා. So again they are checking that. Again doing that. කොච්චර ඇවිල්ලා main door එක වැහුවත් අරක that window I didn't check it නේ. Not sure. So ගිහලා again check it and make sure it. ආයෙ වෙන මොකක්. එතකොට ඉතින් කොහොමද යන්න තියෙන ගමන පැයක් විතර වරක් වෙනවා ඉතින් එතකොට. යන්න බෑ. So the other person, he can't go with the other person. He can't make himself and go also, because if he left the place and go, so then he or she can't concentrate for the next thing. අයියෝ I didn't check it නේ එක වෙලාද දන්නේ අරක වෙලාද දන්නේ and giving telephone calls for the others and ask them to check it. එක check කරන්න මේක check කරන්න ඒක හරිද නැත්නම් ඒක ගියේ වෙලේ ඉඳලා ගෙදර යන් අරක බලන්න ඕනේ. I haven't done that. So she also very very uncomfortable. එයාටත් concentrate කරලා අර peaceful mind එකෙන්, if it is a wedding, no party or whatever, can't enjoy. She's not in a peaceful mind, and sometimes like they are getting headaches. ඊට පස්සේ ඒව ප්‍රශ්න නැත. ඒවත් එක්ක තමයි ගොඩක් වෙලාවට එන්නේ. හැබැයි දැන් ඒව තැනට අයනවා කියලා කියන්නේ OCD has become severe. ඔය severity එකට එන්න it's being long lasting. When we are asking that කොහොමද හාවෙකම ගොඩක් OCD හම්බෙච්ච අය ඊට පස්සේ තියෙන්නේ time duration was like first symptoms appeared වෙච්ච කාලයක් මතකත් නැහැ. And sometimes the marriage එකේදී ගොඩක් වෙලාවට they are coming with husband and wife. So if the husband has the problem, if he has the marriage එකට ආපුවම මෙතනදී මට there's a one person I met, I think I shared it. මට මතක නැහැ did කියලා. He was 42 or 41. So yeah, so he came with his wife. She has the issue cleaning, washing issue. So he came once it got worst part in a sense, he just being withdrawn from the society, and he had stopped his business. He was doing some very good business related with software, computer hardware or something. So he stopped that, closed that shop, because he really don't want to associate people. So then once he is coming to that point, it's a problem. Now he also know that, because he know that obviously he has a small baby, months old baby kenek hitiye, daughter baby girl kenek like 9 or 10 months kind of that. So now he has a daughter kind of that, not like in a single life he's married and having a baby and have to have economical establishment. But no, he can't find. So then he decided himself to come. So he's been diagnosed as a severe OCD. That OCD was there for more than 20 years, because then I had to talk to the parents, like 41 or 42. අහපුවමකෝ මේක අතෝදන්න ඕන එක ඕන එක O level ස්කෝල යන කාලේ නම තිබ්බට. So more than 20 years. No treatments. So now it has come to a severe point because he has having a excessive fear for germs, and Baba Podini having a small baby. කවුරු හරි ඇවිල්ලා බබාව ඇල්ලුවොත් එහෙම he take the baby once the person had gone, take the baby and go and giving a full bath. ටැප් එකට අරනවා ළමයාව. ඉතින් ළමයා හිතන්නේ දවසට දෙතුන් පාර මාස 10කට උතර ළමයා නාද්දි කොහොමද වෙන්නේ කියලා. So then wife was telling, once it happened, and now he is telling because he knows that the giving a bath for the child is not good කියන එක. So he is telling for family members not to take the child out. කාටවත් ළමයා පෙන්නන්න එපා. දැන් ළමයාව නාවන්නත් බෑ, අර නාවන්න නැති ඉන්නත් බෑ. So that was the severe OCD එක නම් it took a long time. More than 1 year වගේ ගියා counselling, but he got control. සාමාන්‍ය දුරකට යාට shop එක open කරගෙන යන තරමට control වුණා. He was controlled after 1.5 years වගේ he came for counselling. Yeah. So with the medication and all, however, like he's come to a control level, not to have all sort of things. So OCD in a sense, repetitive behavior and the repetitive thoughts. Main thing is the thought. So the repetitive thoughts and the repetitive behavior, it could be the not only cleaning, right? So checking, so cleaning, all sort of things are there. Right? Is it clear? The therapies for OCD is the same thing for the phobias, Voltema, REBT, CBT, relaxation, and the graded exposure therapy. Those are the treatments for that. And ළමයින්ගේ OCD තත්ත්වයන් තමයි ගොඩක් වෙලාවට they are keeping the pens in order. ළමයින් භාවිතා පෑන් එහෙම පැන්සල් එහෙම they used to keep in order. And සමහර ළමයි කරන දෙයක් තමයි හිතන්න දැන් sharp කරාම pencils 4ක් තියෙනවා කියලා හිතන්න. There are 4 pencils in the box. They want to have the same size. The centimeter 1 centimeter 9ක් කියලා හිතන්න. One pencil is 9 centimeters. නෑ 6 centimeters. So other one is 7, one is 5.5, and one is 8. So then they want to make it into one size. එහෙනම් 5.5 වෙනකන් ඉතුරු ටික උල් කරනවා. එහෙම කරන ළමයි ඉන්නවා. ඉතින් අපි සමහර ළමයින්ට බනිනවා, එහෙම කරාම ගහනවා. හැබැයි ඒක නෙමෙයි. It is a symptom of OCD. එහෙම වුණාම ඉතින් බැනලා ගහලා නෙමෙයි. Like if it is not only a pencil එකෙන් පටන් අරගෙන යන එකක් නම් you can just explain the child and try to avoid it. නෑ මේක ප්‍රශ්නයක් නෑ, කිසි ප්‍රශ්නයක් නෑ. There is no problem of having different sizes. You try not to think about it කියලා you can generalize it. හැබැයි ටිකක් step by step යනවා නම් we can't do that, right? So the best thing is අපි කරන්න බැරි වැඩ කරන්න ඕනේ because OCD හැදෙන්නේ because of a thinking pattern එකක් නිසා chemical imbalance එකක්. Right? So chemical imbalance එක හින්දා තමයි OCD. All the diseases here, phobia, stress, anxiety, OCD මේ ඔක්කොම හැදෙන්නේ because of chemical imbalances, hormones and neurotransmitters imbalance නිසා. So we have nothing to do. Verbally we have nothing to do. For everything, that's what we do say, we have to go for a psychiatrist. සයිකියාට්‍රික් කෙනෙකුට යන්න ඇත්තටම බය වෙන්න ඕනේ නැහැ. දැන් උණ හෙම්බිරිස්සාව වැදුනා ෆිසිෂියන් කෙනෙකුට යනවා urine problem එකක් අහම we go for a urologist, and if there is a skin problem we go for a dermatologist. So if there is some chemical issues, hormone and neurotransmitters issues, we go for a psychiatrist. Mental problems කියලා දාන්න නැත්නම් මිනිස්සු බය වෙනවානේ. Neurotransmitters and chemical hormones imbalances කියලා දාගත්තාම like පොඩක් බය වෙනවා අඩුයි. So and we have to go for a psychiatrist. And the other thing like ළමයි කරන එකක් තමයි පිටු අරිනවා. They just leave the pages. ඔන්න පැත්තක් ලියනවා, තව පිටුවක් අරිනවා, තව පිටුවක් in order. ගොඩක් වෙලාවට පිටු ඇර ඇර තමයි ලියලා තියෙන්නේ. පිටුවක් දෙකක් අරිනවා. ඒ වගේ they write in order. And තව කරනවා මේ pen ඕක and pens එහෙම පිළිවෙලට තියෙනවා. And if they, and also they prefer to buy lots of pens in same color. Blue එකෙන් 4ක් 5ක්, red එකෙන් 2 3ක්, black වලින් ඒ වගේ kind of that. They used to buy pens. And sometimes the same pen. හැබැයි same pen එක නම් ඉතින් අර ලස්සනට ලියවෙන හින්දා they we used to buy. But pencil is there. Sharp කරන එක. Even color pencils, they want to keep all the color pencils in the same size. ඒක අතිනුත් හදනවා සමහරට පොඩි අය. පිළිවෙලට නැත්තම්. Yeah, ඔවත් එක්ක පිටුවරින් එකක් තියෙනවා. And the other one is like washing thing, because they are not happy and having some thoughts of germs, and germs will kill me, I will be getting allergies or something like that කියලා. They do wash, they do have a bath, and they do have a body wash. සමහර දවසට එකපාරක් it's okay. Every day having a body wash also fine. But these people, උදෙත් නානවා, දවල්ුත් නානවා, රෑත් නානවා, for everything having a wash. මොන හරි ඇල්ලුවත් මේවා කරනවා. And after this corona, like lot of OCD people has been increased, and they got severe because of this germ thing, and the hand washing and using hand sanitizers, and some they do use Dettol. Dettol වලින් අත හොදන තත්ත්වයකට එනවා සමහර අය, and it's very unhealthy. And you know, some people they used to wash the all sort of things with soap. කෑම පළතුරු සමහරලා ඉන්නවා OCD අය පළතුරු සබන් දාලා හොදනවා, එළවලු සබන් දාලා හොදනවා. And yeah, and the other one is hoarding. Hoarding also one thing of OCD symptom. Hoarding කියලා කියන්නේ කිසි දෙයක් විසික් කරන්නේ. They don't throw anything. දැන් අපි තුමු ගෑස් කරලා පරණ සෙරප්පු ටිකක් තියෙනවා. There were some slippers not using also. දාන්නෙත් නෑ, and all sort of cobwebs were there, and එක කැඩිලා, හැම ගිහිල්ලා, discolored, everything was, whatever the things happened to that shoes. But විසික් කරන්න ගිය ගම, no, why you are throwing that? I'm going to use them. I can use them. Keep it. It is all still usable. Go and keep it. I'm using that. කියලා තියන. විසික් කරන්න දෙන්නේ. කුණු ගොඩෙන් ආයෙ උස්සගෙන එනවා. And go and keep it. And ආයෙ මතක නෑ. He or she can't remember that. Again it's there. ඒකට කැඩීලා ගියාට පස්සේ කාටවත් දෙන්නේ. ඒ දෙන්නේ නැති, it's not greediness. Please don't misunderstand. It is not greediness. It is been like he wants to keep it. He think, no, there is some validity of that. I should not throw these things. I should not, අර නාස්ති කරන්න ඕනේ. I should not misuse them. අර waste කරන්න, those things are not, I mean, I do not waste things කියන එක වගේ අනේ thought එකත් එක්ක නාස්ති කරන්න ඕනේ. එහෙම කියන, it's not greediness. Of course it's not greediness. Right? So එහෙම තියෙනවා. And සමහර අයට they want to keep all the things අර පේන මානේ just to have it. පේන තියෙන කබඩ් එකකට දාන්නේ නෑ. මේකත් මෙතන තියෙනවා. I'm using that නේ. I don't want to keep it aside. අන්න ඒකත් තියෙන. මේකත් ඕනේ මට. Keep it on the table. මේකත් ඕනේ. මේසෙන් භාගයක්ම වැහිලා ගිහින්. But never use. තියෙනවා දාන්නේ නෑ. මම මේකත් කනවා හොමුම කියලා තිබ්බට never use such things. So those things are very common. ඉතින් තියෙනවා ඉතින් සමහරවිට දැන් even when I was telling you all, සමහරට you all also must be like, okay, this person have these things නේ කියලා හිතන නැද්ද? There are. ඔක තියෙනවා. It's very common ඉතින්. Some people they live with this condition. ඉතින් සමහර අයට ඉන්න බෑ ගොඩක් ලාට. ඉතින් හරි අමාරු. It's very difficult to live with these people. Have to tolerate it නේ. It's totally upside down. The system is totally upside down. We have to tolerate it. Tolerate is not easy. සමහරවිට tolerate කරගෙන ඉන්නවා. ඉතින් සමහරලාට ඉන්න බෑ. ලොකු ප්‍රශ්න. ගොඩක් ලාට තියෙන ඔය washing ප්‍රශ්න නැතුව other than that අනිත් ඒවා ලොකුවට එන්නේ නැහැ. ක්ලිනික් එකට එන්නේ නැහැ කියලා කියන්නේ like අද අනිත් මිනිස්සයාගෙන් තමයි complain එක වෙන්නේ. So then husband and තියෙන්නේ wife is complaining and then bringing the husband back to the clinic. Washing එකට තමයි ගොඩක් කලාට යාම ඇවිල්ලා කියන්නේ I have this problem because he she or he himself understand it නේ. නානවා අසනීපත් වෙනවා, අනිත් අයටත් කරදර කරනවා කියන එක. Other than that අනිත් ඒවා ලොකුවට ප්‍රශ්නයක් වෙන්නේ නැහැ. checking එක ටිකක් like it's being a problem. Coding කියන එක ප්‍රශ්න වෙන්නේ අනිත් අයට. ගොඩක් වෙලාවට. Not to that person. Checking එකත් සමහරලාට he is telling I am being very careful not like y'all කියලා be careful කියලා පැයක් විතර check කරන්නත් බෑනේ. It's not like that. And these people checking කරන අයගේ they are always not in the delay line because they find difficult to make it on time. Letter එකක් දෙන්න බෑ. They are being very stressed thinking there would be some errors. මට වැරදියා. There would be some errors. I might do any mistakes කියලා. They do keep on checking that. So once one of my colleague when we were doing the big way, I guess, where she used to share it where place where she worked. මතකම OCD ගැන කතා කරද්දී she used to say my boss is like that. Let එකක් ගෙහෙන් දුන්නාම නේ ආයෙ check කරන්න then I am getting all sort of words and telling him because there's nothing errors, nothing is there, but he's keep on giving that killer. Then he said definitely he might be having OCD කියලා. Yes, that is the thing. So වගේ එහෙම තියෙනවා. ඉතින් එතකොට like we have to understand it now since you all are doing this psychology and talking about all sort of things. So then I mean we have nothing to do. තරහ ගිහින් වැඩක් නැහැ. Of course we get angry, but I think alarm yourself. Okay, this person has this issue, so I'll be calm down here. Right, so OCD also the same. We do CBT, REBT, relaxation, and the graded exposure therapy.
Ma'am,
Yes.
are those OCD people expecting for the people who are around them also to become like them?
Yes, yeah, they do.
So,
Washing babawa. So he wanted to expect the wife to, and he's telling wife to go and wash the baby. Wife, how can I, ma'am? Like, I wash the baby. But he can't control. He takes the baby and go and wash it. So he realized it later. Then he realized it and said, no. So I am asking my baby to keep the baby inside. They make. එකනේ අර check කරාම උනත් like අනිත් අයටත් දැන් අනිත් අය සමහරලාට especially when we are working with OCD ඉතින්ක ඒගොල්ලෝ කරන විදිහක් තියෙනවානේ schedule එකක්. ඒකට අපි ඒ විදිහට අපි කරන්නේ නැත්නම් they are getting annoying. And නෑ do this first and do this, keep it there. ඔයගේ advices ගොඩයි ඉතින් එතකොට. Okay.
yes.
I hope it's clear for you all.
Ma'am, you told that students they leave pages when they are writing.
Yeah.
Like I met like some students, they was grade 6, just they were promoted by September only. So until grade 5 they were writing with the pencil, and when they come to grade 6 they started writing with the pen. And like I marked the book around like after one lesson is over only. Then when I collected, I found one student has left pages, and I thought she is absent, and I put absent likewise. But when it is going on, I found that most of the pages she leave like one and one. Then I understood that she is leaving this for something like ink, because of the ink that is traced on the next page. So when I asked her why did she do that, she was like, no miss, the ink is there. No, if I write there, it will be ugly like that. And when madam checked the book, she started blaming for wasting the pages and all. So she was like, then after I explained them not to waste the pages, just write it there, no problem, that ink will dry soon when you're writing and all. So is it because OCD, or is it because that they just started writing with the pen and they have no idea about
Could
that?
be. I mean, like if it's going to be first initial, like it's an initial stage of it. By like now, since you notice it and just advise her and say, because she had the problem in the mind, it is ugly. I mean, ink is not dried yet, and it's not dried yet, and it's ugly. It could. I mean, there is a possibility to continue it for the OCD as well. So now since
So
the child being addressed kind of that, it could be stopped also. Just note it.
yeah,
I
after
mean,
that
just
she stopped, right? Like
alarm
every one of them like, well, okay, then when one started doing, everyone started following that also later on.
it
And
could happen, I think. But just being an alert, like whether she's getting any other things කියලා.
Okay, ma'am. Right.
Things I mentioned, all keeping all the things, pens, pencils, and books. Then these kids like they want to have their bag එකට දාද්දි අර ලස්සනට පැක් කරනවා ඒක. And takes long time. ගෙදර යන්නත් පරක් වෙනවා ඉතින් දාන විදිහට. So they are having such issues, especially kids.
Yes, ma'am. Okay, thank you.
Okay. Right. Others, any questions before winding up the session? Okay, right then. If you all don't have questions, we can wind up. Right. Okay, then. So then we'll wind up for today. And so next week, I'll just confirm y'all. I haven't got the final decision from the college yet. So then I'll contact the college people and I'll just inform y'all how it's been gone. Is going to be a 1 day. I hope it's be a 1 day, but I'll try to get it the time 3 hours at a stretch without having on Friday. If not, we'll have the same time. If they don't have a possibility to have the simultaneous sessions on Zoom. So then we'll have it. So I'll drop the message on your group, your thread by Monday or Tuesday. So please let me know like ahead of time, what is the, I saw that you all been discussing that. Please give your support for the, whoever the person who takes the responsibility for that, and just discuss it, because I just want to do the things without wasting the time. Because when we are doing the mock session also, I had to keep on asking who is next and who is next. So can't do that with the assignment comes. So I really want to have an order. I prefer that. So just let me know by Wednesday what is the order going on. So then I can easily mark the sheets and get ready for that. Since it's an assignment, I want to mark it and have the name list kind of that. So just do the needful and give the support. And also one thing, so if y'all can just drop me your name and your index, whatever the registration or admission number which was given by the college, because your assignments marks are gone with the admission number. I hope y'all have the admission number. Is that so?
Yes, ma'am.
Yeah.
Do y'all have, right? Okay, so each and everyone just drop a message with the admission number, so then I can make a mark sheet for you all. And also please give me the order also by Wednesday. Okay, girls?
The date is confirmed, right?
Yeah, date is confirmed. 12th is confirmed, but like I'm trying to get the 3-hour sessions like from 6:30 to 9:30. So the thing is, there is another session going on, but today, like they said, now they have got because the simultaneous Zoom thing was little bit of complicated. So if they can arrange it for only for this Thursday, so then we can have the 3-hour session at a stretch and just done our assignment. So I'll speak to the college and get back to you all by Monday or Tuesday for sure. Just keep that in mind and just go ahead with the order. So if karagana bari not, so we'll do the first 5 or 6 for Thursday and the rest of it on Wednesday, Friday. There is no any other option, right? So just a 1 day thing. ඔය පොඩ්ඩක් ඔක කවුරු හරි challenge මම බලමු කවුද challenge එක ගන්න පුළුවන් මෙතන challengeable කට්ටිය කවුද කියලා. challenge එකක් ගන්න පුළුවන් අයන volunteers වෙලා ඉදිරිපත් වෙන will do කියලා. So we'll see who can take the challenge and see. ඔච්චර හිතන්න යන්නත් එපා ඇත්තටම. Right. Okay, so just let me know what is going on. Okay then. Okay, then we'll wind up for today. So have a nice weekend and all the best for assignment and get ready.
Nice. Thank you.
Good night, ma'am. Thank you.
Okay,
Thank
good
you,
night.
ma'am. Good
Good
night.
night, ma'am.